So hi everyone, my name's Shane Turner. I'm co-chair of the International Outreach chapter of the Australasian College of Road Safety, and this is one of our webinars that we run each year on road safety internationally. Our main speaker is going to be Gail, who's going to talk about who I'll introduce formally later on, talking about safe system practice in Botswana. But to kick off, I'm just going to do a bit of a presentation on the Australasian College of Road Safety, because I know a number of you are members, but there are also a few people joining us who aren't members. So I'll switch on to that now. All right. Hi there, everyone. That's me. I'm the co-chair of the chapter, and Gail, who's also going to be speaking later on, is the African co-chair, and Mazria, who's from Malaysia, she is the Asian co-chair, so hopefully she'll also be on the call today. So I'm just, as I said, going to give a little bit of a talk about the College of Road Safety and what we do and what we offer members. And so who is the college? Well, it's the Peak Membership Association for Road Safety in New Zealand and Australia. Apologies. The purpose of the college is to support our members who represent areas of road safety across the whole span of road safety. So I work in the engineering side of road safety, but we have people working right across the whole road safety sector. Our vision is to the elimination of fatal and serious injuries for all road users in New Zealand and Australia, but also helping those who are trying to do the same in other countries in the world. And so how does the college support this vision? Through advocacy, events, and professional development. So there is advocacy that goes on with our governments to try and promote that they do more in road safety and to push back on things that we think are negative. We hold events like the annual conference and webinars like this, some in-person events also in New Zealand and Australia across the chapters. And obviously there's some mentoring that occurs between more senior and new professionals. So there are 9 chapters. The chapter that is hosting this is called the International Outreach chapter. So that's generally all members that are of the college who are based outside of New Zealand and Australia. Most of which are from lower middle income countries, but we also have members that are from higher income countries as well. And then there's the chapters around the Australian states and territories and New Zealand. And so as well as being involved in the International Outreach Committee, there's a number of us like myself who are also involved in these local chapters. I'm involved in the New Zealand chapter of the college. So as well as chapters, we have networks. So if you become a member of the college, you'll go into one of these chapters, but if you qualify, you can become a member of one of these networks. So these are very active groups. So we have the Early Career Network for people who are generally under 30, although I think maybe even you can be a little bit older than that and be a member of the Early Career Network. There's the Local Government Network, so that has a focus on the local roads rather than the national or state roads and how you improve safety. Often large networks with very spread out numbers of crashes. And then we, of course, also have the Women in Road Safety Network too. So and that's a fairly active network as well. So if you become a member, then you can join one of those chapters and those networks. So I'm going to just in a minute play a video which really outlines some of the benefits of being a member. it interviews a number of the members, and includes myself and Masrio, who are co-chairs of this committee. So some of the benefits that are offered is there's a weekly alert that comes out with news about what's happening in road safety in New Zealand, Australia, and internationally. And we do welcome articles from other countries. So if you've got an interesting article, then you can contact the Office of the College of Road Safety, and they'll publish that in the weekly alerts. We do webinars and meetings like the one that you're on now. There's often in-person meetings as well in Australia and New Zealand with the chapters, and some hybrid events, which are both virtual and in-person. There's the professional development through the networks. So obviously the networking with other people in the college who are more experienced, you can obviously ask questions and interact with those people. There's a discounted rate for the annual conference. So each year the college puts on the Australasian Road Safety Conference. This year in September, that was in Cairns, Australia. The next one, which is in Queensland, state of Queensland, and the next year is going to be in Tasmania, in the city of Hobart, in the southern part of Australia. And those are really good conferences with really good content. There is access to scholarships also, particularly for lower middle income countries. So each year at the conference, we sponsor around 3 or 4 people to come from overseas to the conference and pay for their travel costs and accommodation and registration. And we also offer some virtual memberships too, so that you can dial in from your home country. There's obviously the networking with other people, which is, I suppose, best maybe in the in-person meetings and conference, but can still occur through meetings like this. And recently they've launched the members-only website area with discussion forums, and that has discussions on various topics that are of interest in road safety. And there's also a chapter forum. We have one for the International Outreach chapter. So if you want to become a member of the college, if you're based in a lower middle income country and want to be an individual member, the annual fee is $10, that's 10 Australian dollars a year, because we're really trying to encourage more people from lower middle income countries to link with the college and use it as an opportunity to learn more about road safety and learn things they can apply in their own countries. There is also corporate member opportunities, depending on the income of the country and what level of corporate membership you want to have. If you're interested in this, I would suggest that you contact the Australasian College of Road Safety Office and Ingrid Johnson about that, talk about corporate membership. But in terms of the membership for this, that allows you to attend all webinars, not just the ones from the IOC, but any webinar by any of the chapter committees. And normally, if you're not a member, you pay at least $10 to attend one of those webinars. So if you are interested in going to a few of those webinars, then your money will be more than paid off by becoming a member. And this is how you link and connect to the college through the website and the membership tab, or email the office. So if you have any questions, you can contact me or the office, but about membership. So hopefully that's been informative. So I'm just going to play a video which will outline some of the benefits that some of our members have got from being part of the college. So bear with me for a moment. Yeah, well, hopefully you can hear that. Let me know if you can't.
For our ambitious goal We know that we cannot achieve it as a single.
Yeah, it's audible.
That's why we need to be linked, working across the globe.
So working?
For everyone. Being a member of ACRS.
Yes, it's audible.
Because it really ensures that any policy or communications or strategy work that I'm doing, I feel confident that there's a whole group of people out there that I can call and contact if I want to bounce an idea off them.
ACRS serves as a platform for creating knowledge among road safety leaders who work mainly focusing on saving lives in this region.
International Road Safety Conference capture the best road safety practices as shared at international level.
Being able to connect members of the college together with our colleagues in India so that they can share their experience and share their learning.
So being a member of the college is a huge benefit for the work I do in New Zealand. So the issues that we face in road safety obviously do differ between countries, but there's a lot of synergy in the big problems that we're all facing.
Being a member of the Australian College of Road Safety brings a lot of credibility to our advocacy work.
In this region and in Qatar, the Australian experience with road safety is highly regarded. We're seen as world leaders in managing, developing, implementing road safety programs and projects.
The conference is a fantastic personal development and training opportunity every year, and I walk away feeling very motivated and very well informed.
I recommend this forum to my colleagues, my friends, and road safety professionals that they must join this forum.
I love the mix of delegates, road safety experts, academics, practitioners.
My major benefit of going to the conference has been the ability to actually be able to promote and show off some of the great road safety work we're doing in New Zealand, and this has paid off in us getting project work with clients in Australia.
The journal is a great source of information for what everybody is doing all around the world.
You will always find high quality research, independent voices.
It covers an enormous breadth of topics right across the SAFE system and with great quality.
The weekly email newsletter is a fantastic resource because it gives you an overview of what issues are during that week.
Working internationally, it's actually important to see what's happening on a week-to-week basis. So you're looking at stuff that's happening at the UN, ministerial conferences, those sorts of things.
In our busy lifestyles, we get so many emails, but when those ones come through, we always read them because they're always full of things that are happening now in road safety.
Many of the challenges that we face in India are ones that have been dealt with by college members in the past about how to design and build and manage roads more safely. We work closely with the Highway Department and the World Bank on assessing national highways. So the opportunity we have with the college is to connect with the knowledge and the people who have shared those same experiences that can also be used here in the Philippines.
The Australian College of Road Safety is unique in the way that it is very personalised. The networking is amazing, and you literally talk to people you've never spoken to before. I've been involved in a number of societies related to transportation. What is very unique about ACRS is that ACRS is only for road safety.
The whole community are involved in road safety. It's a shared responsibility.
So the college has such a wealth of knowledge and expertise across so many different disciplines and between academics and practitioners that I just don't think there's actually anything else in terms of an organisation that can compare to what you get in being a member of the college.
I cannot imagine working in this field without being part of this community.
All right, so hopefully bear with me a minute. I've got to get rid of this thing and bring up the next slideshow. All right, well, hi everyone. So hopefully you found that very informative, and obviously we're here to answer any questions about becoming members of the college if you want to talk to us about that later on. But I'll now move on and we'll go into the main topic of this conference, which is around the application of SAFE system in Botswana in particular, which my friend and co-chair, Gail, is going to present. I've talked to Gail, and our plan is that he will go through the presentation and we'll take questions at the end. So if you have any questions, please put them in the Q&A box on the slide. But I'll first of all introduce Gail, who's based, as I said, in Botswana. Gail is the co-founder and vice coordinator of SORSA, Botswana's first youth and children focused road safety NGO. This organisation has partnered with FIA Foundation, Puma Energy, Amend Org, and Vivo Energy Botswana on a proven effective school area road safety program. This program provides simple, targeted infrastructure measures around primary schools, including footpaths, speed humps, walk paths, bollards, and pedestrian crossings that decrease vehicle speeds and separate children pedestrians from traffic. SORS also pioneered the training and assessment of schools with IRAP star rating app, and working with Emergency Assistant 911 and FIA Foundation to put infrastructure in schools. Gail has over 10 years working in road safety and partnering with Global Alliance, UNEP, ANWAC, IRF, and Walk 21 to deliver and implement road safety solutions locally and globally. And it's a real delight to have Gail here to do a presentation on the work that he has been doing and is about to do in Botswana. So I'll hand it over to you now, Gail. Thank you.
Thank you, Shane. Thank you for the introduction. Next slide, please.
Next one.
Yeah, and the next one. Next one. Next one. All right. Well, thank you. Good morning, good afternoon, good evening, wherever you are. Like Shane introduced me, I'm the African co-chair for the International Outreach Committee for the ACRS. This is just a discussion. I'm not here to tell you anything we are just here to share information. We are just here to discuss and just have a little bit of the context of the SSA in Africa, particularly in Botswana's context. So the presentation for the overview, we're going to have the introduction, the safe system principles, safe system elements, case study, conclusion, and resources, and the Q&A at the end, like my friend Shane mentioned. Next slide. Our current reality, as it stands, you know that traffic fatalities affect everyone, everywhere where they are. So globally, we lose 1.25 million, and in Botswana, we lose around 249. I just use the statistics for 2021 because they were the one which were readily available. So later, when we want the one for the 2022, I can organize, because we get our statistics from the Botswana Police Service Traffic Division. Next slide, Shane. Yeah, that's our country. We are in the Southern Africa. We are a landlocked country. We are a small population, about 2.5 million. That's our flag there. Next slide, Shane. Botswana roads, these are some of, I just took some of our roads. So on the left there, that is our government enclave. That is our Attorney General. Just behind the building, the white building, is the Ministry of Health. And on the right, that's one of our roads, our intersections. Next slide. So every year we lose thousands of lives. That if I don't know if it's visible, So that's the synopsis, just an overview how much we lose from 2019, 2020 up to 2021. So we in Botswana, we're a small country, small population. So if we lose a lot of lives, that will hardly impact on us. Next slide, Shane. That's the fatal crashes and fatalities. Again, I just used the statistics from 2019 to 2021. So you can just see from the blue one is the fatal crashes, and the red one is the fatalities. Next slide, Shane. So this is the summary of road crashes by cause. We have the animal, the wild animal or domestic animal, which seems to be the highest cause or main cause. Then we have others, driver, any other negligence. Then we have the influence of drinks or drugs, and we have all others, as you can see on the table. Next slide, Shane. A new direction. So we haven't fully, let me just make it clear, we haven't fully adopted the system approach in Botswana. Is something that we, as the civil society, we are lobbying and advocating for our government to adopt it as one of the interventions that we can fight this road fatalities pandemic. So you'll see as I proceed with my presentation, some of the things and the elements in the safe system approach we are already doing, but some we are not doing, but we haven't holistically adopted the system. But I think with our stakeholders and with our NGO advocacy and lobby, we will get there. So we know that human makes mistakes, so we have to be accommodating and keeping impacts on the body at a tolerance level. Next slide, Shane. So the successful system approach adopters, we have Sweden, the Vision Zero. We have the Netherlands, sustainable safety. We have the Australia with safe system, and the New Zealand with safe journeys. So this slide I just put to appreciate and benchmark from what other countries are doing. I remember when I went to the third ministerial conference in Stockholm. So Stockholm hosted the last ministerial conference. So you can see this some of the case studies or the best practices. Next slide, Shane. So the SSA in Botswana, we have adopted the second decade of action, which we all know that the target is 50% halving road crashes by 50% by 2030. The decade of action. So we also want to talk more about the 50 by 30. So the halving road death and serious injuries by 2030. And also we have a successful project that we just launched lately. It is called the 1.8 billion campaign, the Global Forum for Adolescents. Our president and our first lady were in the forefront. In September, they attended the SDG Summit in New York. And in October, we launched the commitment for the adolescents. So we are partnering with the FIA Foundation, we are partnering with the WHO, we are partnering with other road safety stakeholders. So it really brought us through results because we involve the young people. So instead of blaming the young people, we should involve the young people in the solutions. So this is some of our efforts or our intervention. Next slide, Shane. So the safe system approach itself. So we have the system itself, and it deals with the We have the elements, there have been the safe vehicles, safer speeds, safe roads, post-crash, and safe road users. So it's a holistic system that goes hand in hand, and it caters for the human error and for the forgiven rules. So we have to have forgiven rules so that we know that humans can make mistakes. Therefore, we need to cater for that, and we need to eliminate the crashes. We need to prevent the injuries or serious crashes. Next slide, Shane. So these are the principles of the safe system elements that I just mentioned. Next slide. So we have our principles, our system principle, that we want zero death or serious injuries. One life lost is too many, so we don't want to lose any life, or we want to prevent any injuries. We know that humans make mistakes, so we need to factor in that. Humans are vulnerable, our bodies are vulnerable. So okay, so just sorry for that. Responsibility is shared, so this is a multi-stakeholder and it's a collaborative. No one can do road safety alone. Road safety is a collective effort. Safety is proactive, and redundancy is crucial. Next slide, Shane. So death or serious injury is not acceptable. So this is one of the pictures that we have put during the global meeting for road safety NGOs. We increase where we put in the pictures for the people that we lost through road crashes. So this is not acceptable. Next slide, Shane. Yeah, we know that women makes mistakes, so we have to cater for that, and that's why we need to appreciate and adopt the system. Next slide, Shane. Our bodies are very vulnerable. You know that we can be poked or hit by something that your body will be hurt or will be vulnerable to that injury. Next slide. Responsibilities shared. This is where we come, like today's webinar. This is one of the efforts that we share the responsibility, despite where we are all sitting. So we need the system managers, the planners, maintenance operators, the law enforcement, the vehicle manufacturers, post-crash personnel, and system users. So we need to integrate all this together. Then we can see the holistic and acceptable way for the system, or to prevent crash or serious injury. Next slide, Shane. We need to safety is proactive. You need to identify the risk and mitigate the risk. You need to first identify what's the problem, what's the cause, and then after we identify that, that's when we can come up with a solution. That's when we can know where the problem and where we can address the problem, because we cannot put the vaccine, a wrong vaccine in a wrong symptom. So we need to know if the problem is speeding, or if the problem is drinking, or if the problem is non-compliance, or whatever. Next slide, Shane. So this is just continuation of the safety. Next slide. I think I've talked about the elements of the safe system approach. Safe road user. So either we walk or we bike, we drive, we transit, or other. So this is one of the elements of the system. Next slide. Safer vehicles. We all know that Volvo, for example, I just use Volvo. They enhance the safety features, or they put the safety features of the driver and the pedestrian at heart when they are designing their nice cars. So this is safer vehicles that we need to put measures that will reduce the chances of crash occurring, and other like autonomous braking and the air cab and other crash absorbing vehicle scrambles and the like. Next slide, Shane. So safer speed, you know that if you are hit by a vehicle traveling at 23 kilometers per hour, you have the 10% chances of survival, and 42, 20%, and 58, 38. So that's why we also advocate at our NGO, we advocate for 30 kilometers per hour across around the school zones. So that means that children are very vulnerable. What I talked about earlier, you're also vulnerable. So imagine, that's why the law for us in Botswana, we are happy to share that in the Road Traffic Act, it's a law that around the school zones, the speed limit is 30 kilometers per hour, which is a good thing. And we just need to enforce or to emphasize or educate. So I think on that regard, we are doing well, and it will complement our infrastructure improvements projects that we do, that Shane talked about earlier when he introduced me. That is to put the speed hump, the road signs, the walkway, and the mural. Next slide, Shane. Reducing crashes. This is just to say these are one of the interventions or the efforts that we want to do to avoid crashes, and like separating lanes, having like the bike lane. Because in Botswana, we just upgraded our roads where we just putting on the walk path and the bicycle lanes, and increasing the lanes for the road. So it's an infrastructures that we accept, and we lobby and advocated for, because the cyclists were getting knocked down, and when they were just riding next to the roads, the pedestrians were also knocked out, and there were no facilities where they, like the pedestrian crossing where they cross, and the other speed calming interventions, and separating users' time, increasing attentive and awareness. Just to say, road safety education, we have like the what you call the bus ride campaign, whereby we do the outreaches, the education outreaches. We do the bus stop, where we are by the bus stops and making the outreach activities, and the mall campaigns. Even when people are going to the malls, we still target them and we teach them about road safety. Next slide, Shane. We have a very robust post-crash care in our country. We are trying. We have the parastatals that care or deals with people who have been involved in crashes. That is to say, unfortunately for the life lost, I think Brett is here. I saw him on the attendance list. He came here some few months back to facilitate. So we saw through the motor vehicle accident fund, when you lost your life in the road crashes, the parastatal or the fund assist you with the funeral cover. They also have the support the private emergency medical services when when the crashes occur, they rush to the scene to assist the victims. Like, you know that the golden hour, 1 hour, you need to work around to save lives. Yeah. So we also have the Ministry of Health with the medical emergency services to deploy the ambulances and other facilities, or air rescue or airlifting in case of the crash. Next slide, Shane. So this is the newly built intersection roads that I was talking about earlier. So we have these pictures are not very visible, but we have where there's a walk path and the cycling lane. So there's some of the roads goes overhead, some of the intersections. So we have built them mostly in the busier road and in the city. city of Gaborone, the city center. So we're still with the loan for the World Bank. We're still optimistic that we'll build more roads or more intersections to cater for safety and ease the traffic and put the safety features. Next slide, Shay. So in terms of speed enforcement interventions, we have the LED light. The LED light is that the first picture, the yellow one that shows you at how much. It's more like a speed camera or speed trap. It shows you when maybe driving it at 60 kilometers per hour zone. It will show you that congratulations, Shay, you are driving at a correct speed. You also have what you call it a boost bus, the one in the middle. Just a police bus with a small office and a small holding cell for those who maybe Shane, if he took too many drinks to drive, they'll just detain him for some days there or a day, so that he can be fit to drive. And we also have the highway patrols that they patrol the roads, and they also always visible around the busier roads. Next slide, Shane. The road safety education interventions. Also, we have the mobile office, whereby we can see here the children were going in to learn more about road safety, learn about road safety clubs, learn more about safety or education in general. So the good thing about it, it moves around. It's movable. It moves around the schools or around different areas. We also have the road safety promotion vehicles. They're more like police cars, but not fully finished police cars. That they promote road safety. Like they have the first aid kit, they have the cones, they have the sirens, and like when there's a lot of animals on the road, they will alert the drivers. Next slide, Shane. So this is just to say where we are in the safe system approach. We have the traditional approach, and we have the system approach. To say prevent crashes, the traditional approach is to prevent crashes, but safe system approach say prevent death and serious injuries. Improve the human behavior, design for human mistakes and limitation. Control speeding, reduce system kinetic energy. Individuals are responsible. So that is to say, share responsibilities that we talked about earlier. React based on the crash history, let's say proactively identify and address the risk. Next slide, Shane. And this is my last slide. Thank you very much for listening attentively for my presentation from Botswana and me as the African co-chair. Thank you, Shane. Thank you, everybody. We'll see you. You're not audible, Shane. You're not audible, Shane.
Yeah, it does help if you put the microphone on. Hi, everyone. Sorry, I do realise that there seems to be a problem with actually putting questions through. There is one question here. So please let me know if you can't put a question through. Maybe send it to my email address, which is shane.turner@abley.com if you can't. But we do have one question here from Brett Hughes. So I'll ask you, Gail, I'll take you through that. So what Brett has said is very good, Gail. I agree. A really good presentation. Great stuff going on in Botswana. Can you explain the role of Botswana's insurer, the Motor Vehicle Accident Fund? Specifically, can you talk about MVA's role in improving road safety, such as community engagement, road safety promotion? Not all countries or even states in Australia have insurers who do this. Thanks, Brent.
Thank you, Brett, for the question. I think MVA's role is through the Department for Injury Prevention, they have what you call community-based grants, that they disperse the grant for the civil society or for the groups that will then go into the community to implement education activities, road safety education activities. I think that's where they come in, and they also augment those activities. Either they plan them with the community. For instance, maybe let's say you are having school outreach, or maybe a scholar patrol training, for example. So it's either we partner with them or they empower us to go and do the scholar patrol. Because remember, they cannot do everything alone, but they can also empower, because they can support or sponsor those kind of activity. So I don't know, Brett, if I answered your question fully.
I thought that was a very good answer there, Gail. I don't seem to have any other questions at the moment, but I do have one or two myself, so I'll ask those, and hopefully some other questions will come through. So I was quite interested in road safety committees, and whether you have road safety governance and technical committees in Botswana that are trying to coordinate some of the road safety work that's happening at a national and a local level.
All right. Yeah.
Yeah.
No, thanks for Shane. Yeah, we have what you call under the Ministry of Transport and Public Works, under Department of Road Transport and Services. We have what you call NASEC. NASEC is the National Road Safety Committee, whereby it's chaired by the permanent secretary and the Minister of Transport. So it's a committee that a lot of different stakeholders sit in. Like, for example, our organization sit in the police, the roads, the MVA, all other stakeholders. It's a committee. It's more like a working committee. So that's the one that coordinates. So the Ministry of Transport, being the lead agency, have that committee that sit and is chaired by the permanent secretary. So the permanent secretary is the one who calls who chairs the committee, but reports to the Minister of Transport. Thank you.
Very good. I was interested. You said that your speed limits around schools are quite low. Are they? But obviously, there can also be issues with people travelling above those speed limits. And I noticed some of the work that you do with speed humps and that type of stuff. So, I was just wondering whether you do enforcement of those speed limits.
Yeah. No, thanks, Shane. Yeah, we have under our law, under our Road Traffic Act, the speed limits there is a law that exists. It's on the RTA. But then in terms of enforcement, we have the police, and we have what we call from the Ministry of Transport, we have what we call transport inspectors. So they are like police, but they're not full police, but they're called transport inspectors. So they work hand in hand with the police to enforce. They also have been given the mandate to issue a ticket also. So they do more the same work with the police. So we around the schools that we have put the infrastructure improvements around. That's where we work mostly with them to do the enforcement. So for us, we do the education, and for the police and the transport inspectors do the enforcement.
Yeah, and then I imagine others do the engineering work that's required to try and, like the speed humps and the other stuff that you were talking about. Do you make a recommendation of that to ministry and others to actually do that physical works? Is that something that comes through discussions with the school?
Yeah, normally when we do this kind of project, we do the needs assessment first to see which school is mostly vulnerable, which school have the highest statistics, because you don't just pick any random school. We see the school which needs what, because sometimes you'll see that in that particular school they have other infrastructure. They're just shorting others. They lack others. So you'll find that maybe there's a speed hump, there's no pedestrian crossing, or maybe there's a drop-off zone, but there's no other. So we just put what is needed. We don't just put the whole. If something is already existing, there's no need to put it there. So we only put the what is lacking.
Yeah, the questions in here, but I suppose one other thing that would be useful for people who are attending the webinar, if they wanted to learn a bit more about road safety work in Botswana and some of the stuff that you're doing, do you have, are you able to provide some links to maybe strategies and action plans? Is that available over the web? Yep.
Yeah, I'll just leave my email also. But we have like the website for motor vehicle, the MVA fund, that we have all the information. The Ministry of Transport, then they will find all the information there. Then we are also available in the social media platforms. So you can just search for our organization, the Society of Road Safety Ambassadors. I think they should find our contacts there.
Awesome. Sorry, I'm asking all the questions. No one else is, so I'm asking them. But hopefully that's okay. So you know, one of the things that we found in New Zealand when we moved from the traditional approach to the safe system approach was that we had to do quite a lot of training. We're still having to do quite a lot of training to help people understand, you know, the principles of the safe system approach. So is there training going on in Botswana in terms of teaching the police and others what safe system principles are and the change in approach that you need to take when you adopt safe system?
Yes. Actually, we have the budget, or the stakeholders that we work with. We have what you call in the different district, the district road safety committees. So each district has its own district road safety committee. So the approach was to teach and capacitate all the district road safety committees. So it's something that is on the pipeline. It's something that we have done, maybe tried on a small scale, but we want to increase to other parts. So training and education is something that we do regularly and vigorously. Yes.
Very good. Well, I think I might have run out of questions, but so unless we get some questions in the next few minutes, we might have to wind up the webinar. But that was really interesting, and it was also interesting your answers to the questions. It sounds like you're pretty organised there in terms of the road safety work that you're doing with the committees and the and such like. And you know, obviously, congratulations to moving to the safe system approach, because I think, as you pointed out early on in your presentation, countries that have done that have seen quite big reductions in the number of deaths and serious injuries. So interestingly, that you know, even in America, they've only just recently adopted that approach. So it's interesting to see what's going on over there and how things are changing as a result of the safe system approach. Cool.
Thank you, Shane.
That was really great, Gail. So we might wind it up there because we haven't getting any other questions. But I'm sure if you do think of a question later on, you can contact Gail by his email, and I'm sure he'll be happy to answer any questions. But it is really great to see how another country is, as I say, embracing safe system and applying it. So yeah, that's really great. So thanks very much. All right. Any final words, Gail, before we bring it to a close?
Just to appreciate the participants today, and just to share with them that for them attending today's webinar, we have something for them. Maybe at the end, I don't know if you and Masria will organize their certificates.
Yep.
Yeah, and just to appreciate you, your hard work, and to giving me the opportunity to present and share the case study of Botswana. That I appreciate very much, and thankful. Thank you, Shane.
Thank you, Gowan. Thanks for reminding me that we'll be sending out certificates to those that are participating in the webinar today. So thank you all for coming along and listening on this webinar. And we do have several other webinars planned in the new year, covering other topics, both from Asia and in Africa. I think the next one might even be on IRAP in Thailand. So particularly if you're members of the college, then you'll get a notification of that. If you're not, I'm encouraging you to become a member and come along to those future webinars. So thanks everyone for attending, and goodbye for now.